authorizations keep me alive? Bullshit! Now I'm standing in your lobby. Do you hear me now? I don't want to die. Do you hear me, UnitedHealthcare?
They keep saying, oh, look how many people are on Medicare Advantage. Everybody loves this. No, we don't. We're stuck in it. I can't leave.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up. Hey, it's Jordan. Delighted to be joined by Jenn Coffey. Jenn, you have been in one hell of a fight in the most recent years with UnitedHealthcare, which has obviously been in the news in the recent month for what I believe is its predatory practices. You have a really heart-wrenching story. Let me just show folks you were at a protest along with a lot of others being abused by UnitedHealthcare. This was in April of 2024. Let me show folks some of your story here.
I've spent the last year begging you for a $600 infusion to treat the most painful disease known to modern medicine, CRPS, complex regional pain syndrome, the suicide disease. Let me tell you, a year ago while UnitedHealthcare was celebrating over $8 billion in first quarter profits, I was selling the last of my belongings that had any value.
So tell me, when did your health issues begin? And, you know, you have UnitedHealthcare, Medicare Advantage, which is the more privatized plan. Tell me when this started to develop and when the first issues with them began.
So in 2013, I was a fully functioning EMT. I had a lot of jobs. And then I was diagnosed with breast cancer. I went to Dana-Farber, Brigham and Women's, and unfortunately, things didn't go well. I had 3 surgeries within a year. And then I developed complex regional pain syndrome, also known as the suicide disease. It's the most painful disease known in medicine. I also have severe small fiber neuropathy, and of course, rare disease comes with friends. So there's a lot going on, and it requires a lot of treatment, a lot of care. I have a great medical team. When I did become disabled, I started losing everything because I got sick, right? So, you know, my life fell apart. I lost my house, I lost everything. And then I found myself basically bedbound. One thing though was because of being sick, I made a really, really bad choice. And I went with Medicare Advantage instead of staying on traditional Medicare and getting a supplement. I didn't understand it all. And being sick and scared and miserable, I made the wrong choice, and that choice is costing me because now I'm stuck with it.
And when all this happened, hate to ask a lady her age, but were you relatively like early Medicare?
I was only 42 years old when I got sick. I was an EMT. My doctor hated my caffeine intake. Like that was, you know, I lifted people for a living. That was the joke, right? I worked in hospital. I worked on an ambulance. You know, I did a lot. But then when the breast cancer hit, everything just went wrong. I went in for surgery and came out 12 and a half hours later. Nobody could explain why. And I couldn't even stand up straight. And it just got miserably horrible. And
this pain disease that you call the suicide disease, my quick research on it, I mean, this is debilitating physical pain in multiple parts of your body, and obviously affects your mental health as well.
100%. I mean, you have to understand, when people say the word pain, they have a view of what that means. But pain with CRPS is literally feeling like you're on fire. And it will get to where like my legs feel like I'm wrapped in barbed wire and I'm walking on top of broken glass and I'm on fire and I can't get out of the heat and I can't get away from it. I mean, it's torture. The #1 killer of CRPS patients is suicide. You know, that's 70% of people choose that, and they shouldn't have to because there's treatment available. And when the doctor said that ketamine infusions could literally get me out of the bed, I had been locked in for over 2 years. I wanted to try to live. You know, I was really, really doing poorly. I was about to sign my DNR, really. And then he goes, but there's a catch, right? The insurance isn't going to cover this. You're going to pay for it 100% out of pocket. So I literally sold my life and raised the initial $5,000 to start the treatments, and it worked. I mean, you have no idea. My home was my jail cell. You know, when the rest of the world got locked into COVID, I was already there. I had already been laying in a bed. You know, I knew what that was like. And you have to keep paying for it. And the doctors have to pay their staff too. I mean, they're like, the doctors aren't being unreasonable to be paid to give you the treatment, right? But then what happened was, well, you know, after COVID, what happened to a lot of us, my rent went way up. All of a sudden, $400 all at once, and it was devastating. My infusions were $600. So I had to have the money come from somewhere. I started rationing the infusions, and it was really going badly. I mean, badly enough to the point that my doctor and I were talking about the drug of last resort, which is called IVIG. And there's a whole story behind why that's difficult.
And
So
with United Health at the time, what was their reason for denying it? Were they saying this isn't medically necessary?
The doctor's offices said they couldn't bill it. They didn't have the codes to bill it. They didn't know how to bill it, and the insurance companies wouldn't tell them. And the insurance companies have a clause. United Health has a clause that says we're not going to cover ketamine infusions, and that clause allows doctors to charge cash, to get the infusions. You know. Then what happened was a friend invited me to an event, and I found out about People's Action, and they offered to help me fight. But it was hard. Like I had spent the last decade hiding basically from all that happened. And here I am putting my life out there for everybody to see.
Let me show this.
It was horrible.
Let me show this. This was you at this protest, just detailing the battle just to get one injection. Here we go.
I put my life on display in hopes of getting permission from UnitedHealthcare to stay alive. How can you sit there? How do you look in the mirror? Petition to shame UnitedHealthcare, and it worked. They contacted me on Twitter and said they would cover my infusions. How do you give a ketamine infusion without saline? Yes, too. These are the things you ignored. Can you hear me in there?
Yeah,
so you were begging them basically for a year?
We embarrassed them. We did petitions and everything and videos to embarrass them. They gave me a prior authorization. I'm excited. I'm getting treatment. I go in for treatment. It's time to pay the bill, and they deny they deny a ton of the bill. They wouldn't pay for the saline. They didn't want to pay for the cardiac monitor. You have to understand this infusion is really hard. For me, it's hard. For some people, not as bad. But for me, they have to put me completely out. And the medication doesn't feel very good to me. And when it's over, I end up brutally ill. But the end result is I can get out of bed. I can walk around. I can have a life that's worth living, not just existing. Right? So they wouldn't pay for this. So I had to go embarrass them again. I had to go to my senators. I literally went to DC, right? And went to my senators and told them what was going on. And then United Health approved that. And I think my problem's solved, but it's not. Every time I need an infusion, I got to get another prior authorization. Then I got to watch to see if they pay the bill. November 2023, I go in for an infusion. It's time to pay the bill. They paid $1.22.
And how much was the bill?
The bill is a couple $1,000s. I mean, you've got 4 hours of sedation under cardiac monitoring with the staff, with the fluids, with everything else that I need. I mean, I want to live. This is what it takes, right? Like, what do you do when that's what it takes?
Yeah.
And then, I appealed it, right? Jordan, I appealed it, and they freaking redid the bill for $1.01. They lowered it. So then I go back to my senators again, complaining again. They put in another complaint with CMS. Then they paid $833. That is the most they've ever paid for my treatment. It's a correct amount to pay for my treatment. They haven't paid for a treatment like that since. I'm still fighting right now. I'm fighting the March bill from 2024 because they've only agreed to pay about $280 of it. They told my senator that they mailed a check to my doctor. My doctor says he never got a check. I mean, it's brutal. It's brutal.
And I want to take people inside to what you're dealing with, because, you know, for example, fibromyalgia, people call that the invisible disease because people can't see it. So a lot of times with things like this, people can't see your pain, but you're describing feeling like barbed wire on your legs. Can you describe even getting to DC from New Hampshire? I
Oh my
mean,
gosh.
it has to be very
It's a
grueling for
chore.
you. Yeah.
Oh, big time. But it's worth it, right? It's worth it because at this point, it's not even, it's about, yes, I want to stay alive and get my treatments, but there's so many other people out there. Like, I have heard so many stories. I go to get to DC and somebody has to drive me. I don't really get behind the wheel. I'm afraid of what could happen. I was an EMT. I'm afraid of watching somebody else get put in a rig because of me, right? So I get driven there. And when I get to the airport, they get a wheelchair to help me because I walk with a forearm crutch cane and I can't walk huge distances. I am limited. I have, when they tried to rebuild me after the cancer, they messed up my core and it spasms horribly. And that is super painful. It's like having somebody sit on top of half your chest, half my diaphragm, half my lung, half my stomach. Everything's compressed. So I got to get wheeled up.
You're not an elderly old lady either. No disrespect
No,
to
I'm
Yeah.
53. I mean,
Right.
I should still be driving an ambulance. I should still be able to run. It's so, it can be just so difficult. But so I get to the airport, they get a wheelchair, they bring me to the gate. Now I'm at the gate. Well, they moved the gate. So now nobody comes to get me. So I have to find somebody to get me to the other gate. Then it's time to finally get on the plane. They have to bring me down in the chair because I've tried walking it, but sometimes they're inclined or declined. And it just, too many near falls. So they got to bring me down. Then there's, I get in the plane, fine, come out. There's always a wheelchair waiting for me. Get out of there. They take me to get my luggage and then out to where I can get a car. Then whatever team I'm working with gets me a car. They get me to a hotel. And then I have to rest. I have to just lay down and then get a shower chair so I can bathe because I can't stand up and take a shower. Like, you know how horrible that is? Like, I go to the Y because I can experience a warm pool and get some exercise, which is great for my body. But I got to make sure I can get a handicap shower because I can't stand up and take a shower.
Right.
I mean, I used to run after things and run pushing a code cart, and you have no idea how much I miss what I used to be able to do and how much I realize now I took for granted being able to do that work.
And can you tell me, because obviously you've had to depend on neighbors and friends to help you with these bills, with Medicare Advantage, you said you made the mistake of choosing that. How much were you paying with Medicare Advantage on top of all these bills that they were charging you? And what?
And I had a premium.
Right. Why did you choose that? What were you kind of hoodwinked into it, or it was just kind of like, hey, it sounded
Fear.
Right.
It was fear. I had just I was just disabled. I just had all these surgeries. I lost my house. I lost everything. I had to give up my car so I could not have car payments and not have insurance payments to afford to pay for the infusions. So it just snowballs like that. And I'm sorry. I'm sorry. Can you please repeat your question? My brain just.
Yeah, no problem.
I get brain fog.
Oh, totally understandable. What prompted you into Medicare Advantage? Because I've talked to people where they're getting calls over and over from brokers or companies, basically selling you this, frankly, bill of goods. And to the normal layman, it sounds good.
Right. It's supposed to cover everything Medicare covers, but have a cheaper cost. In the beginning, there wasn't a premium, and I lost my job. I didn't have my income anymore. I was getting disability income, and that's, a big change. I couldn't make my bills. So I took the cheaper option. thinking it was the right choice, not realizing, not knowing I was literally locked in, right?
Mhm.
So when I realized that I couldn't get out, and let me tell you, the reason is I can't get a Medicare supplemental policy. In order to get that in all but 4 or 5 states in the country, you have to go through underwriting. So it's a people keep saying pre-existing conditions don't happen anymore. That's total bullshit. I mean, my pre-existing conditions are what keep me from being able to get a Medicare supplemental. I called a broker, they laughed at me. I called
Wow.
the commissioner's office, they told me to talk to the feds. You know, and we're actually trying to change the law now in New Hampshire. So the people who are most vulnerable, the disabled and the elderly, don't have to face underwriting to get a Medicare supplemental. Then you can go back to traditional Medicare. Because right
And when you
now,
say
sure,
when you
I can
say
go
when you
back.
say when you say underwriting, what
Okay.
what does that look like? How do you do that?
So, and that's the pre-existing conditions. If you have a pre-existing condition, they will not cover it for 6 months to a year. They will up your premium incredibly. If they will even offer you a policy, they can literally say, I'm not going to insure you because you have too many pre-existing conditions. So you're locked out of getting a Medicare supplemental plan. You can't get one, which means you're on the hook for 20% of every single bill, a lab, a doctor's appointment, every single bill, if you go back to traditional Medicare. Traditional Medicare doesn't make me get a prior authorization. In rare instances, what they do, they talk to the doctor, then they approve it. We have these situations where doctors are begging for their patients, and somebody on a phone somewhere who's never even examined the patient is saying, nah, no,
Can
you
you
don't need
also
that.
describe, because you've already described the physical maze to get from point A to point Z, you know, but how many hours have you spent on the phone? I mean,
Oh my
because
God.
you're talking about the insurance companies, then you got to call the feds, then you got to call the doctors. I mean, this has to be a bureaucratic mountain.
It's a job. It's a job to be on the phone. I mean, I get to points where I actually just stop because I'm so overwhelmed. But it's getting on the phone, being on hold. I've been on hold as long as 3 hours. It was funny. I had a United Healthcare service navigator who's supposed to be there to help me, but every time they assign me one, they disappear. So this service navigator was calling on my behalf, and she's like, "Oh, I'll just have you know, I was on hold for an hour." And I'm like, really? I've done 3 hours with United Healthcare. You've got room. It's just like, you're gonna throw that at me, and like, you're trying to make me feel bad. I'm literally trying to stay alive, and you're trying to make me feel bad that you spent a whole hour on the phone for me while I've spent 3 hours getting hung up on. Then I got to dial back in, and you go through a 10-minute process to get back on the right hold line. You listen to the
Right.
same stupid hold music. I mean, that's enough to just mentally just get to you, because it doesn't even change. It's just the same tune repetitively over and over. 2 hours, 2.5 hours, 3 hours. And
Mhm.
this is what you're doing. And your choice is to just give up. And
And
that is,
when you finally get folks from United Healthcare in specific on the phone, is it one of those things where, well, let me transfer you to another department, or do they actually give you an explanation why they can't cover this or why there's no code for it? Or
so when I was talking about that November infusion, the infusion before it, when the bill got, with the prior authorization, the bill got sent in, they denied the bill. They told me it was the wrong codes. So the doctor changed it, resubmitted it. They paid that bill. Then the November infusion, I told you the $1.22, they said it was a subcode that the doctor did wrong. And when I talked to the doctor's office manager, they're like, what is a subcode? What are they talking about? It's every excuse in the world. And then at one point, they finally gave my doctor's office this magic phone number to go to, and he got approved the one time. But now, right now, I have no prior authorization. I can't get a service navigator. I keep trying to, and I get nowhere, nowhere.
well, what's a service
I
navigator?
So a service navigator is supposed to be somebody the insurance company gives you to help you navigate your health, to help you get prior authorizations, to help you find an in-network provider. And oh my God, the doctor I'm talking about, my doctor who gives me my infusions, he is not in network for me. He's in network with UnitedHealthcare, except their Medicare Advantage policies. Why is that? Why is that? And the law says they're supposed to give me a provider. They're supposed to have an adequate network, never mind one provider. They don't have a single provider to offer me. And I still am fighting with them over half of my bills with Dr. No being out of network, which means he gets paid less. I'm supposed to pay more. And it's not supposed to be that way. They'll give me an in-network cost on the prior authorization for the infusion, but I'm out of network when I go in for my ablation.
Yeah, it sounds like they're just making it up as they go along.
Because they don't want to give up the money. They made $8 billion in profit in 3 months. I'm literally standing in your lobby telling you I don't want to die. You made $8 billion in profit, and I can't get you to spend $600, $800 on an infusion.
Let me,
because I don't want to die.
Let me show that moment. It was very powerful.
Your executive office contacted my primary asking for a referral to a doctor you picked for me. A doctor who's retired at a clinic that closed in 2019. I have an email from my primary asking me about the requested referral, a referral that UnitedHealthcare initiated rather than pay my doctor. If they can't starve our doctors into contracting with them for ridiculously low reimbursement rates, they'll kill me off by sending me to a non-existent clinic. Seriously, you couldn't even pick up the phone to find out if where you wanted to send me even existed. Prior authorizations keep me alive? Bullshit! Bullshit! I've shared my story with the White House, and I've been to every possible place to meet and talk to UnitedHealthcare. Now I'm standing in your lobby. Do you hear me now? I don't want to die. Do you hear me, UnitedHealthcare? This is one of my denials.
I'd like to ask, you said that you got in touch with your senators in New Hampshire, Shaheen, and I forget the other one. What is their Hassan? What is their response? Do you even get to talk to them, or is it their office? Do they have any broader responses on this predatory system? Because we know from the Democrats, it's been, well, people love their private health care and la, la, la.
You know, their office staff, the constituent services, is who's really been a huge help to me. And they are run by the senators, and I do thank them for having that. I would love to see them do more to stop this. Like, I wonder if they even realize that the Medicare numbers, they keep saying, oh, look how many people are on Medicare Advantage. Everybody loves this. No, we don't. We're stuck in it. I can't leave. It's like Hotel California. You check in, you can't get the heck out. I'm stuck in a Medicare Advantage. I can't leave Medicare Advantage. I can pick any Medicare Advantage, but I can't go back to traditional because nobody will sell me that supplement. And I feel like maybe that doesn't get heard. I know that one of my friends has a son who's autistic and was cold called and taken off of his traditional Medicare and put on a Medicare Advantage. And my friend was able to fix it because she got a notice immediately, an email, and she was able to go and fix it. But we took that, and Senator Hassan actually brought that up in a hearing, you know, because these predatory ways that they're able to coerce people onto these Medicare Advantage policies should be criminal. You shouldn't be able to cold call somebody not knowing if they are able to make those decisions 100% on their own and make a life-altering decision that can literally take away every single provider they have, because Medicare Advantage demands networks.
And it seems like your choice. It seems like your choice, if you're 53, is, I don't know, wait 12 years till you're 65 to get on Medicare.
I'm lucky. I think it's 67 for me, but yeah, I'm lucky. At 67, I get a second bite at the apple. I'll be able to switch back to traditional Medicare, and the insurance companies will be required to sell me a Medicare supplemental policy without worrying about pre-existing conditions. for
Well,
people who are older than me who are already stuck. You know, there's 248 million, I think, denials a year, some sick number like that. I'm one person fighting one. We don't have enough to do that. I need legislative change. I need
right.
my senators and my congressmen to listen to me and make changes at the federal level because we're bleeding.
But
We're
also,
losing
I mean,
our lives.
yeah, you're lucky, but who knows what condition you'll be in 14 years if you have to wait that long. I mean, this is a debilitating illness. You called it the suicide disease. I mean, I'm hoping it never
It would
gets
be
that
great.
bad, but
It would be so amazing to be able to just go get an infusion when I need one instead of trying to because I'm scared, right? I've got kind of insurance coverage, kind of not. And I had to agree to pay anything less than my cash price. So I worry that if they don't pay, I'm going to get hit with a huge bill. That's already happened once. I already got a big bill once. Right. And yeah, it's that constant fear. And on top of that, I have medications I pay for out of pocket that I can't get through my insurance. One of them, if I get it through my insurance, it's $80 a month. If I use a coupon and go to the grocery store, I can get it knocked down to maybe 60. If I go to Cost Plus, I can get it maybe knocked down to 30 if they have it in stock. I feel like I'm playing roulette with my medications all the time, trying to figure out, like recently, I literally had a medication I was days away from running out of. Nobody had it. And I'm trying to call around to every pharmacy and just anybody, do you even have a week's worth? Anything that can get me through, because this medication helps my body control my temperature, my functions, my vision. There's a lot going on there, and to suddenly stop taking it could really be bad. And this is life with healthcare in America, and it shouldn't be this way, right? I remember when I was younger, I used to go to the pharmacy, and the pharmacist knew you, right? They knew your diseases, they knew what medications you were on, they knew your allergies. I remember when I had cancer, going on the tamoxifen after, and the pharmacist going, oh, I know you take this, so don't take that with it. Not a good thing. That's not life anymore. Now I've got, I don't know how many pharmacists. And when you talk, and if they're not in, they're not in. I'm like, can anybody tell me what's going to happen to me when I suddenly stop this medicine? There's nobody to talk to. They'll be back on Monday. Great. Like, what is this? There's no human care in our healthcare. Right.
What you mentioned you had to, sell all your belongings, you lost your house. I mean, what's your situation now? Because you're disabled. I mean, how do you live?
I'm on disability. I live in an apartment. I have roommates and cut expenses that way. You learn to live with less. And it's not like I've never been there before. I mean, I was young and stupid once. I mean, at one point in my life, I think I had a jar of peanut butter and a spoon, like $20, my worst once. So I consider myself lucky. I have a home to live in. I have loving people around me. There's food in my belly. I have 2 adorable cats. I get to paint. I've found a lot of relief in artistry and doing things in macrame. When the symptoms are really bad, I can distract myself with a paintbrush or with doing some macrame. And that just, for me, I've created a new life that is full of creativity and love. And I hold on to that. I have a good support system, and I'm super lucky to have that. I have great doctors. I have a really great medical team, that does everything they can for me as much as possible. I know one of them wanted to send me for a nutrition counselor to try and help me come up with meals that I could do in the kitchen that didn't create as much physical labor, because I've had more symptoms going on. And yeah, that insurance won't cover that. It's $300 for the hour. Like, that's okay. I'll pass. I think I'll do some Google research. Yeah. But, this is American healthcare, and unfortunately, it shouldn't be this way. We're the only country that attaches our healthcare to a job. So the minute I got cancer, it was like, there goes your job. There goes your healthcare.
I think your story shows, in the campaigns, president, Senate, Congress, Obamacare is always thrown out there. We got to save Obamacare. Republicans want to kill it. Well, apparently Obamacare is not really covering all those pre-existing conditions.
Not all of them, but we can fix that. We don't throw the baby out with the bathwater. This is where
Right.
we're at, right? You don't want to, it's great that kids can be on their parents' insurance to 26 and go to
Mhm.
college and not be in fear or buy college insurance. I remember trying to take care of those things for my own son and not doing it when it was me that was in college.
Mhm.
You know, this is wrong how we're doing it, and we are in a place right now where I think we could really assess and change that. I want to be able to go to my doctor, get treatment, go home, and not live in fear of getting a huge bill.
Right.
Not trying to stretch the time out between infusions because I want to stretch the bill out.
Right. Right.
I have a buddy that lives in the Netherlands. He has stage 4 breast cancer. And honestly, I don't think he would be alive if he lived in the United States.
Yeah.
His doctor orders a test, he gets it. He orders a medication, goes to the pharmacy, he gets it. There's nobody standing there going, prove you need it.
Right. I'd like to get your response to this. This was Andrew Whitty, the CEO of United Health Group, following the murder of Brian Thompson. He was sending a message to his employees that kind of leaked out to the public. It was supposed to be private, but he said some things about what he believes their role is. I'd like your response to it.
And there are very few people in the history of the US healthcare industry who had a bigger positive effect on American healthcare than Brian. And we are going to make sure that we not only acknowledge and honor that legacy of Brian, but we'll continue it. Our role is a critical role, and we make sure that care is safe, appropriate, and is delivered when people need it. And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
So they are the guardians against unsafe and unnecessary care. What's interesting is everything you've described is they've intentionally made the system too complicated so that they could make more money.
I was a provider and I didn't do anything unnecessary. Doctors and nurses and providers take care of their patients because they want them to live. They'd love to spend some time with them doing preventative care, talking about the things that they never have time for. But insurance companies allow 15 minutes if you're lucky? I have a very complex health history. My doctors can't do 15 minutes with me. If they want to, they can't do 15 minutes with me because there's too much they have to check on, right? I also have secondary hypertension caused by all of this that's going on. And that's what happens when you get sick. To say unnecessary is horrible. I don't see that. I have a friend right now who is in significant discomfort and the doctor wants an MRI and the insurance company said, no, why don't you try PT first? And I don't understand that. Because I think you want to look inside and see what's going on before you want to manipulate it around.
Right.
We need to change the rules. It needs to be that the care is covered unless you can prove why it shouldn't be. It should be approved first, not deny first and prove it that you need it.
Right.
When seconds matter, these minutes are too long.
Mm-hmm.
To use an old EMS term, when seconds matter, minutes matter. Life is judged in those golden moments when you first get on scene. Everything you do at the very beginning is what matters to save that life. When that person rolls into that ER, everything you're doing right then and there, that's what matters. And when the doctor goes, I don't know what's going on in there, we need to look at it. We should be able to get an MRI and look at it. We don't, because MRIs are expensive and they don't want to spend that money. They want to keep that for their profit. I actually had somebody chastise me and tell me that insurance companies need to make money to keep their lights on. I'm sorry, when I was in DC, when Sir Whitty was testifying before our senators, I listened to a senator talk about how when Change got hacked and they weren't paying their doctors, this doctor wasn't getting paid and he didn't have the money to pay his staff to keep his lights on. He's doing, payday loan type stuff to try and keep his lights on. And then United Healthcare apparently went to court and tried to do a hostile takeover of the practice that was going under because they weren't getting paid. This was in the hearing. This was in the hearing. You can watch it on C-SPAN. The senator who asked them about this, and the answer from Mr. Witte was, "We paid them."
I'm pretty sure it would help them keep their lights off if Andrew Witte didn't make nearly $24 million in 2023.
He got a $5 million raise last year.
Oh, so there you go. I'm pretty sure that would help.
Insurance companies got a 3.7% raise from our government, insurance companies. They got a 3.7% increase. I don't know anybody who would balk at getting a 3.7% raise. I remember getting a 0.5%, and I'm like, yoo-hoo, this is great, right? And this is acceptable? No, it shouldn't be. We should be able to put people over profits, care over that cost. You need an X-ray, you get the X-ray. You need an MRI, you need chemo. I watched a hearing in Congress listening to a doctor who does pediatric oncology, and he's talking about begging for a medication for a child with cancer. We're the only country that's happening in. I mean, I don't condone violence by any stretch of the imagination. I am huge into peaceful protest. I mean, I went back out to Minnesota a second time, and we protested outside their facility. And we tried to stop them from denying people for a little while. Maybe buy somebody, I mean, that's how it felt to me, standing there trying to stop people from going into work and denying care. I watch you, Jordan. I've seen people talk about how they're trained to deny. And wrong code, we don't cover anything. Why don't you pick up the phone, call the doctor and say, what happened? Oh, okay, let's pay that bill. Why doesn't that happen? Why isn't that the default that they're supposed to pay? But instead, I have a premium. Right now, I'm paying a premium that's $51. I believe it's 51, 45 or 51. I have co-insurance. I'm on the hook for out of network. It's $75 a visit. That's just to go for an office visit. If there's a procedure, that's co-insurance. Could be 40%. And, you got to come up with the money somewhere, or you don't get the treatment. If I don't have the money, I can't get the treatment. And
with the ketamine infusions that you need, how long does that provide relief for?
I can sometimes stretch out to 3 months now, because I'm also on another drug called low-dose naltrexone that has enabled me to be able to stretch it out. But for over 5 years, I was going every 4 to 6 weeks, and it was $600 a pop every time. And then when the rent thing happened, we just didn't know what to do anymore. And I started rationing. I made it out to 5 months, and first time I made it. The second time, didn't really make it. Everything went to heck in a handbag, and I ended up in a flare that lasted months, and it took forever to get out of it. They ended up having to increase the dose on my low-dose naltrexone, and now I'm stuck at that higher dose because they're afraid that if they drop it, I'll flare right the heck back up again. Right. And my doctor's always telling me he doesn't like the way I do my infusions, that he would rather I did them closer together to keep the receptors shut down in my body, because once they reactivate, it's harder to shut them down again. And that's basically what ketamine does. Having CRPS is like literally being on fire. And the infusion's like a water hose coming over and putting out that flame, and it gets down to a simmer, and you have a quality of life. You can maybe go out to lunch. You can do something, not lie in a bed rolling around wishing for death. And I got to that point, and I'll never go back there. At my worst, they had me on what was left, opioids, a ton of, I was on Oxy and Valium and fentanyl. I couldn't get out of bed. I rolled around in it all day because the pain wasn't gone. It was just dulling my mind. And I was a different human.
And that's the other thing. They won't pay for the treatment you need, but they'll give you this, treasure chest of drugs that makes them more money.
Those will cover. They don't cover my Mestinon, but they will cover Oxy and Valium and fentanyl. And I will never, ever go back to that world, ever. It was a living hell to be so drugged up, and it changed me. And I laid in a bed doing nothing. but just breathing. And that's just no it. Now that I've had a life again and had quality again, I'm not giving that up no matter what. No, I'll sign DNR before I'll give that up. I will never, ever, ever go back on those drugs again. For me, that might be the option for somebody else. So please don't take that the wrong way. For me, in my health, in my situation, it was horrible. And I made bad decisions. I mean, yeah, I lost the house. I lost the land. I was married for well over 20 years. Unfortunately, my ex-husband dove into a bottle and he passed away from overdosing from alcohol. That was shortly, not long after we divorced. When I got sick, it destroyed everybody's lives, not just mine.
What would be your message if Mr. Whitty, Andrew Whitty, the CEO of United Health, but broader, President-elect Trump, Democratic Party leadership, what would be your message to them? Because we've heard for years that, people love their sacred bond with private health insurance and their choices, and it's too expensive, and how are you going to pay for it, all that. What would be your message to the powers that be?
Well, for Sir Whitty, sir, I met you in DC, and you said you would talk to us, and I would love to sit down and have that conversation with you. As far as my government goes, President-elect Trump, you tell us all the time that pre-existing conditions don't matter anymore, but you left out a group of people, the disabled and the elderly. Please change that. Please make it illegal so that pre-existing conditions can't be held against anyone in this country, because everyone in this country should be able to get the health care that they need and they deserve. And my congressmen and my senators, please listen to us. We are telling you we are stuck in Medicare disadvantage. We cannot leave it. We are trapped. We are trapped with less than care. They don't pay what Medicare pays. They don't cover what Medicare covers. That's a lie they fed us. And now we're trapped unless you change the laws. So that's my message. And for the rest of us out there, I hear your stories. Keep sending them to me. Please keep sending them to me. I want to hear you. I want to take those stories and we'll go to your senator. We'll go to your congressman. We will go to the public. We will get you the health care that you need and you deserve. Nobody should have to suffer. And that's the biggest thing. Don't give up. Don't lose hope.
And people can reach you at JennCoffey.com.
Yep. Go to JennCoffey.com, JennCoffey.com. You can find all kinds of information on me there. How long I've been fighting for years. You can see our history, what we've been doing, and please join this fight. I need you with me. Go to JennCoffey.com, JennCoffey.com. Join me. I want to talk to you today.
Thank you for sharing the story. I'm sorry for this hell of an ordeal you've been through, but it's people like you, God willing, that can actually force change. Thanks again.
Thank you, Jordan. Thank you for what you're doing.